There is a pain in your neck, stiffness in your neck, difficulty movements in your neck, sometimes tingling, numbness and weakness in your arms and hands. Yes, what I am talking about? I am talking about cervical spondylosis. Today we are with Dr. Madhusudan. He is a physical therapist and Ayurvedic doctor. So he is going to take all this series called spinal disorder. Let's come, we'll meet Dr. Madhusudan.
Hi, YouTube viewers, myself Dr. Madhusudan KH, consultant in Ayurveda and consultant in physical therapy and rehabilitation. Having 24 years of experience in this field, I'm a second generation medical graduate from my family, running a center by name Pranava Holistic Healing and Rejuvenation, having 4 centers in Bangalore South. Today we're going to educate you on spine disorders. It's the first series of its form. In the name of cervical spondylosis, we're going to educate you along with Dr. Pulikanti Dilip Kumar. It's going to be our first series to educate you all viewers so that you'll come out of these problems very successfully without having any kind of issues in your health and life. This is the first episode what we are going to jointly collaborate for to educate people on YouTube on spine disorders. Today we are going to discuss on cervical spondylosis, very commonly seen between 45 years to 75 years or more, because this is a degenerative disorder secondary to calcium deficiencies usually we see. This is the most commonest clinical features what we find in aging process is spasm around the muscles, around the neck area, around the lower back area, and also sometimes it will be sensations having tingling, numbness and pain which is radiating to hands or to the legs or surrounding the areas of cervical area or on the lower back area. When I say cervical area, it's upper back. When I say lumbar area, it's a lower back. This is a typical model of spine. In an erect position, the spine is like this. You can visualize the anatomical features of a bony spine. This is a cervical curvature, this is a thoracic curvature, this is a lumbar curvature. What happens actually after 45 years? There are a lot of mechanical issues, a lot of nutritional issues and a lot of aging process, hormonal changes in female. These all lead to a lot of changes in the bony structures of the spine and the lumbar area. Especially the actual mechanism is the amount of calcium input and calcium destruction. If these two are matched, usually spondylosis never occurs with a good physical conditioning and a nutritional conditioning. When this is matched, when this is triggered because of less physical activity or nutritional issues or because of any other causative factors like hormonal imbalances. Here a person starts suffering a painful stiff neck around the cervical area. It becomes very difficult to move around the cervical area. First it starts as a functional limitation where a patient starts difficult to move his neck either right side or left side, up, down. Slowly this entire area starts radiating pattern of pain which will be leading up to the hands. Okay, all the cervical symptoms here in the form of spondylosis, a lot of arthritis changes will happen between the disc and between the two bony ends. This leads to a lot of limitations around the cervical area. It causes a lot of pain, restriction and also other complications involving the nerves. Now you have understood very important features and clinical features, how to recognize the pain around your neck area so that how you can understand this and how you can go to a diagnosis. This is very important. Many a times it's better to visit a physician or better to visit a physical therapist or any doctor whom you find nearest, so that the understanding of cervical spondylosis can be well emphasized through x-rays. Cervical epilateral x-rays shows degenerative changes around the cervical area so that we can understand how much is the arthritis, and also we can go for DEXA. DEXA is one more important clinical diagnostic tool to work on calcium mineralization and also demineralization, and also we can come out with a graphical picture to understand how exactly demineralization is happening. These two important factors can really come out diagnostically. Clinical diagnosis can happen very well. Along with that, a general evaluation and a specific local evaluation by a consultant will lead to understand a proper diagnosis of cervical spondylosis. Restriction patterns of movement will be a first clinical features to understand cervical spondylosis, and also tingling, numbness, and also radiating pattern features. When a physician understands this, definitely he can diagnose this as a cervical spondylosis. And coming to understand some more important clinical factors, for example, any vehicular aberrations or discomfort overnight, or when he gets up and starts working on his computer, this all can trigger clinical features, and also it can represent as cervical spondylosis. Later on, it's leading to some other inflammatory process around the cervical area. Coming to diagnosis, this is very important. A clinical diagnosis along with specific evaluation patterns makes us understand cervical spondylosis very clearly. After diagnosis, very important part is coming to a plan of treatment. It's very important to understand cervical spondylosis and its complication and how to plan this entire treatment. If at all we are planning this, we have to come out with a proper treatment pattern. A pain management is very important part in this entire treatments. Here we advise usually pain management therapies in the form of TENS, trans-electrical nerve stimulations, or interferential therapies, or ultrasonic waves, or infrared lamps, or sometimes combination of these therapies will be a very good relieving factors. Along with this, a physician advice in the form of calcium nutrition is very important, and also to improve local circulations or vascular improvements, for we can add vitamin E, and also we can go for calcium supplementation. This is going to really help. And vitamin B12 is also very important supplement factor in improving the cervical spondylosis. Very important thing is, after this pain management, after this nutrition therapy, reconditioning of the muscles is very important, and bringing back all osteophytes around the joint area is a very important factor. For this, exercise therapy plays a very important role. For this, we trigger really isometric exercise entire patterns around cervical areas, around cervical flexors, cervical extensors, cervical side flexors, and cervical rotatory muscle components we try to trigger. And also we're going to trigger deep neck flexors, so that this all isometric neck reflexes will improve vasocirculations and improve entire vasodynamics, which will give amazing improvements in the cervical spondylosis. I'm talking about a complete healing pattern where you're going to plan a pain management. Painkillers always are secondary. Painkillers in many situations have proved secondary effects or maybe a marginal effects because of that. But going through pain management through physical therapy and manual therapy gives a maximum relieving factors. And also nutritional supplementation is very, very important in this. Coming to exercise patterns, we have to trigger entire isometric patterns around the neck area, so that we are triggering entire vasoconstrictions and vasodilation, so that optimizing of nutrition around the neck area, and also improving osteophyte circulations and bringing back normalcy of entire cervical bones is very, very important. This completes entire plan of treatments, and now next we'll plan for a exercise therapy. So that's a very, very important part in improving cervical spondylosis. Thank you. Hi YouTube viewers, myself Dr. Madhusudan KH, consultant for Ayurveda and Physical Medicine Rehabilitation, along with my junior doctor, Dr. Suprita, to demonstrate few exercises of neck exercises, so that how we can avoid cervical spondylosis in a later ages. It's very important to understand. We are all teaming together along with Dr. Dilip Pulikanti for a wonderful demonstration of cervical neck exercises. Coming with neck flexors and neck extensors. This is a spinous process, cervical spine. Keeping it in neutral position is very important. Before asking a client to have a good exercise position is very important. Now we are going to demonstrate isometric neck exercises. Shoulder equally length, it's very important, coming into an alignment, and neutral position of neck is very important. Now we're going to demonstrate cervical neck flexors, isometric exercises. Here my hand is going to give a pressure so that she cannot move her neck forward. Okay, this is a very important position. Either neck moves forward or my hand moves forward. It's a neutral position where all generation of muscle contraction around the cervical neck flexors she's going to demonstrate right now. Force your forehead to my hand right now. When she's forcing her forehead to my hand is preventing all the force. All deep neck flexors along with flexors are getting activated. More of superficial neck flexors here. Contract once again. 1, 2, 3, 4, 5 and relax. A simple hold and relax mechanism for 5 seconds is going to generate active muscle contractions around the cervical flexors, so that the active circulations can happen. Once again I'm going to demonstrate. Once again, cervical deep superficial flexion. Pressurize your forehead to my hand. 1, 2, 3, 4, 5, and relax. This whole relax mechanism, very important part of muscle contraction and relaxation. So the entire uniform generation of contraction delivers a very good vasoconstriction and vasodilation, which can improve nutrition around the muscles and also activates deep neck flexors to a certain extent. Coming to extension part, again making a neutral position of the cervical spine is very important. A proper cervical curvature is maintained. Here we're going to pressurize the back of the head to the hand. Now she's going to generate force in the back side. Generate now. 1, 2, 3, 4, 5. The simple hold and relax mechanism around the neck extensors around the neck area will generate, and automatically a vasoconstriction and vasodilation is going to generate a lot of active movements of micronutrients around the cervical area, which is going to emphasize very good nutrition factor to the inner joint surfaces. Once again, I'm going to demonstrate this. Extend your neck to the hand. 1, 2, 3, 4, 5, and relax. A simple extension exercises contracting isometric way is going to generate a lot of tension around the neck areas to improve the entire conditioning. Right now, I'm going to demonstrate cervical side flexors on the left side. Generate force around your head to the hand. 1, 2, 3, 4, 5, and relax. A simple hold and relax mechanism, which is going to help generate side flexors, isometric contraction, which is going to again improve a lot of circulatory factors here. Once again, I'm going to demonstrate side flexors isometric, where generation of a lot of muscle strength and prevention is yielding a lot of active muscle contractions around the side flexors. Similarly, we're going to demonstrate on the left side, on the right side. Pressurize your side of head to the hand. Try to understand the tension around your side flexors here and relax for 5 seconds. Once again, you're going to do it now. 1, 2, 3, 4, 5. Relax now. You're going to understand entire contraction happening in this way. Okay, now we have finished side flexors, extensors, and flexors. One more important exercise to teach patients is a deep neck flexors, where I'm going to give resistance below the chin. Try to focus on this. Try to generate the force below the chin. My hand is preventing, the chin movement. Lot of deep flexors are going to be activated by this type of exercise. Simple hold and relax mechanism. Every 5 seconds, relax now. And once again, you do it. 1, 2, 3, 4, 5. Relax now. Once again, you can do it for deep neck flexors. 1, 2, 3, 4, 5. Relax now. This completes very important demonstration of neck flexors, extensors, side flexors, and deep neck flexors. Altogether, gives a very good generation of active forces inside the muscle fibers, so that it activates internal environment of entire joint of cervical group of bones, as well as ligaments, as well as entire joint surfaces there. I want you to give your experience while doing neck flexors. What has happened while doing a neck flexors now? Can you do it? Can you explain what has happened while doing this around your neck?
I can get the resistance over these areas, and muscles of this are pulling.
Okay.
Type of sensation over this area.
Okay.
Whereas when you're doing this, all the muscles around this as well as the neck, that is stretching, and I'm relaxing a little bit of my neck also.
Okay. Fine. Fantastic. And these are simple exercises to demonstrate and perform on an aging population, which is going to help. Of course, this can be used as a conditioning exercise for all the generation groups. And when we are speaking about cervical spondylosis, so vulnerable group, so cervical spondylosis, vulnerable group is 45 years and above. People who are at 45 or more, they can practice the exercises and they can prevent cervical spondylosis. Thank you. Hi, YouTube viewers. Here is Mr. Dilip Pulikanti behind the screen, shooting our video screen to help all YouTube viewers. And here is Suprita, Dr. Suprita. She is my assisting doctor to help you to understand deep neck flexors, extensors, and also side flexors to get an isometric contractions and to prevent the cervical group of entire vertebrae to stop degenerative. Myself, Dr. Madhusudan KH, consultant for Ayurveda and Physical Medicine Rehabilitation from Pranava Group of Health Services. I request you to subscribe for this kind of videos, so that your knowledge improves and also you can educate your people in a best way. Thank you.
Yes, how about this? Enjoy.
Enjoy. Yeah.